Welcome back. It's Dr. Denton with Salisbury Eye Care and Eyewear. Today I wanted to do a frequently asked questions video because we get a lot of questions about kids' eye exams, and I thought it would be good to just answer them all here. Okay, so the first question that we get asked, I have them written down here, is when do we start seeing children as patients? So this is really interesting. We actually start seeing children as patients when they're infants. We'll see patients between 6 and 10 months old typically. So the reason we see kids so young is because we participate with a program called Infancy. Infancy is with the American Optometric Association. It's a public health campaign where we provide a free eye exam to all children within their first year of life. So I can see children at any age. I have seen children as young as just a couple weeks old, but typically we wait until they're about 6 to 10 months. That's kind of the optimal time to see a child for their first eye exam. So you might wonder why we would do an eye exam so young, but the reason for that is that there are certain congenital things that can happen to a patient's eyes. We want to look for things like retinoblastoma or other malformations of the eye early on. We also look for large prescriptions. So it's entirely possible for an infant to have a very big prescription. And in kids, so much development is happening in those first 18 months that we really want to make sure that their eyes are well aligned, that they don't have a prescription that's going to inhibit their eye development, and also just make sure that structurally and health-wise everything is where it should be. So that's why we see them so young. And then we also will see children at 2 years old, at 5 years old before they start school, and about every 2 years thereafter if everything's healthy. The second question we get is, why do you need to check children's eyes? Okay, so you want to check children's eyes because there are certain things that can happen, just like in adults. We rule out any congenital issues, we rule out ocular diseases. Those do happen in children as well as adults. We also want to make sure that they don't have a significant prescription, and also that their eyes move and work well together, that they have good eye alignment. So much development is happening between birth, and all throughout childhood really, but visually, especially in those first 18 months, and then all the way out to about 8 years old, we have very plastic visual systems. And what I mean by that is that when they're plastic, we can improve a situation if they're not developing like they should. So a good example is like when a child has a quote unquote lazy eye, or eye that turns in or out. Believe it or not, we can improve vision. You don't have to just have poor vision in one eye because it turned in when you were younger. If we catch these things early, we can put glasses on, we can refer for surgery when needed, and we can impact a child's visual development. The other thing that's very critical is that so much of learning is visual. 80% of learning is visual. Think about how much your child is on a computer or tablet or phone, and so knowing that they're seeing correctly in both eyes, that both eyes are moving and working well together, is absolutely critical for their learning as well. The third question we have is, how is a child's eye exam different? So for adults, we rely greatly on what you tell us, right? So you come in and I talk to you a little bit and say, you can tell me which eye you see well out of, right versus left. You can tell me if it's clear at distance or up close. And we can do a lot of things like subjectively. You can give me information. In children, sometimes we don't have the same amount of subjective information, and so we rely greatly on objective findings. Now, I have a lot of little tricks of the trade where I can tell what your child's prescription is without them saying a thing. We don't have to do the one or two better or worse thing. I actually have something called a retinoscope where I can look in the back of their eye. We have ways of looking at the way their eyes move and work together. Here at Salisbury Eye Care and Eyewear, I use a lot of puppets, a lot of little toys and trinkets to have them follow. We keep their attention. I'm gonna give you a tour of one of our exam rooms that's made especially for kids. But we have a lot of tricks up our sleeve as far as getting them to pay attention, getting them to look in a certain place, and assessing their vision without them saying a word. So the next question is, what are we looking for in a pediatric exam? So in a kid's eye exam, we are actually assessing prescription. We're assessing their visual acuity and what they can see. We're assessing the health of the eyes front to back. We're looking at eye alignment and how the eyes team together and work together, just as we are in an adult's exam. We're just doing it in different ways. Okay, another question that came up was, are eye conditions genetic? So yes, there are inherited eye diseases that occur, and we also know that a person's eyes can change over time, particularly if there is a disease process happening. Your eyes, one of the most critical things I tell patients is, it's really good for me to know what your eyes looked like when you were a child or a teenager or even a young adult, because then when I see you in 10 years and 15 years and 20 years, we can look back and see if there has been a change in your structure of your eye at all. So just the same for kids, it's really important to have that baseline, because sometimes change over time is the best way to tell if a disease is progressing or changing. Another hot topic for kids, and I've been hearing this a lot lately, is the question of blue light protection. So it doesn't feel like it was that long ago that I was in school, but when I see patients now, I'm reminded how much school has changed since I was there 20 years ago or more. So nowadays in school, children are on tablets and screens and smart boards from the very beginning. I know here in North Carolina, in our school district, everybody's on screens from a very early age. Now, screens can be very fatiguing to your eyes. There's something called computer vision syndrome. We've made a video about it before, but it's very important to take a lot of breaks when you're on the computer, to proactively use artificial tears. These are things that help. However, screens also emit a great deal of blue light, and blue light can be very fatiguing to our eyes as well. Now, the studies are still out on exactly the effects of blue light on the back of the eye, but anecdotally in the clinic, I have both adults and children who report eye strain, headaches, just issues with how their eyes feel on computer that is relieved with the use of blue light blocking lenses. So for kids, I usually take it on a case-by-case basis, but in general, we do have a conversation, the parents and I, regarding blue light protection and how that may help a child in their learning environment. All right, so we really appreciate you tuning in today for these frequently asked questions. It is so important for your children to get eye exams. We definitely recommend that for every child, every year. And if you like our content, make sure to like and subscribe. We're here every single Wednesday at 4 o'clock. Thanks for tuning in.